Welcome to the Strategies to Create Safer, Healthier Communities webinar. My name is Shaunda Alford, and I'm with the Local Government Commission. We are excited that you are able to join us for today's webinar. We would like to thank our funder, the California Endowment, for their support, and to the Public Health Institute for partnering with us on this webinar. Before I hand it over to our moderator for today, I want to go over a few logistics. Everyone will be muted except the person speaking. Due to the large number of participants, we ask that you type your comment in the question box. We will be summarizing those questions during the Q&A portion following the presentations. Any of the questions we don't get to, we'll ask the presenters to respond after the webinar, and we will make the responses available on our website, along with speaker presentations, and the recording will be available as well. Now I will hand it over to Karen Ben-Moshe with the California Health and All Policies Task Force.
Thank you so much. I'm really happy to be here today and welcome on this nice afternoon, at least here in Sacramento. I am really excited about today's webinar. I've heard all of these presenters speak before, and so I know you're in for a real treat, as these folks are all experts in different tools and approaches to designing and fostering healthy, safe communities. I'm going to give a very short overview with some background and introduce you to our panelists, and then I'll quickly turn it over to them. As Shawnee said, we'll save questions and answers until all three presenters have finished. So I want to talk really briefly about why this topic is so important. Why are we talking about community safety and violence prevention from a community and planning perspective? First, we know that there are enormous direct and indirect health impacts of unsafe communities. Violence itself is a leading cause of injury, disability, and premature death. There are also important equity considerations. Violence disproportionately impacts low-income communities and communities of color. And there are more indirect health impacts. For example, violence and fear of violence may cause people to stay indoors, in turn reducing physical activity, limiting access to healthy food, and reducing social interactions that would otherwise contribute to community cohesion. In turn, that can lead to overweight, poor nutrition, and stress, which have all been connected to a range of poor health outcomes. Second, safety is a huge concern in many local communities. Through my work supporting the California Health and All Policies Task Force, I've been involved with a number of public workshops throughout the state. At every workshop and in every community, safety, violence, and crime were consistently and continually brought up as key community concerns. While we don't expect community planning to solve the huge issue of community safety, it is important for local governments to understand the role that they can play. Finally, creating resilient, safe communities has the additional benefit of helping us meet other goals, including climate change goals, physical activity goals, and others. Next slide. Just as a little bit more background to the presentation that Paul, Zykofsky, and Maureen Silva will be giving, I wanted to share a little bit more about the work of the California Health and All Policies Task Force. One of the task force's explicit goals is community safety through violence prevention. One project of the task force is developing a guidebook on crime prevention through environmental design. Community safety is a complex field, and this document will address one particular sliver of the issue: strategies to use environmental design to reduce crime and violence in public spaces. The task force is supporting this approach because of its role in promoting health and safety and co-benefits of reducing greenhouse gas emissions as a result of increased active transportation and infill development. Paul and Maureen will talk about a few pieces of that guidebook, which we expect to be out later this year. In addition, I just want to mention that the task force is working on a new plan, which will outline collaborative agency activities to prevent violence and build resilient communities. We've been engaged in a 9-month process to identify current barriers and gaps and opportunities for task force members moving forward. If you're interested in learning more about that, I'm happy to share that after the webinar. And now I want to turn it over to our presenters, who I will first introduce. Paul Zykofsky directs the Local Government Commission's programs related to community design, water, and health in the built environment. During the past 20 years, he has worked with over 250 communities to improve conditions for infill development, walking, biking, and transit, and has helped facilitate participatory design charrettes in over 60 communities. Paul is certified to facilitate workshops on walkable communities, safe routes to school, complete streets, and pedestrian safety. He was born and raised in Mexico and is fluent in Spanish. Paul will discuss crime prevention through community design as one land use technique local communities can use to design infrastructure in a way that supports healthy, crime-free communities. At Prevention Institute, Maureen Silva coordinates a wide range of projects to promote access to healthy foods and active environments across California communities and nationwide. Maureen works to expand health initiatives that build momentum and community capacity to support healthy eating, physical activity, and safe places to play through a focus on health equity and primary prevention strategies. Prior to joining Prevention Institute, Maureen worked as a community nutrition educator with the UC Cooperative Extension, coordinating nutrition and food resource management courses through the UC CalFresh Nutrition Education Program and expanded food and nutrition education program in Contra Costa County. She acquired her master's degree in public health from San Jose State University. Maureen's presentation will describe the importance of collaboration in building healthy communities and how the Prevention Institute Collaboration Multiplier can be applied in your work. Last, but certainly not least, Shaunda Johnson currently oversees the South Sacramento Healthy Eating Active Living Initiative, which is a project funded by Kaiser Permanente. She leads a multi-sectoral coalition of residents, business, community, and faith-based partners in efforts to create a culture of change that increases access to healthy food, physical activity, safe streets, and educational opportunities. Prior to her current position, she was a community organizer with Sacramento ACT and led their violence prevention work. Shaunda also has served as a board member of the Sacramento Safe Community Partnership, the governing body of Sacramento's Ceasefire Gang and Gun Violence Reduction Initiative. She'll discuss a local approach and successful approach to building safer, healthier communities right here in Sacramento. So I would like to turn it over to Paul now.
Great, thanks, Karen. Appreciate it. We'll get our presentation up there and get started. Okay, minor technical difficulties. Okay, I'd like to just start out by introducing the Local Government Commission. Not all of you may know who we are. We are a nonprofit based here in Sacramento, California, and we foster innovation in local environmental sustainability, economic prosperity, and social equity. As our name implies, we work with local governments throughout California. We have members in local government. And we really try to provide inspiration, practical assistance, and a network of visionary local leaders and community leaders. And we also do a lot of our work through workshops and trainings. We do a national conference called New Partners for Smart Growth, which moves around the country every year. And we also do participatory planning and design work, so we get to test out a lot of these approaches in our work in communities. Our history with this issue of crime prevention actually goes back quite some years into the 1990s when we started our work on livable communities and addressed these issues of crime prevention through environmental design and community design and conferences and newsletters. We also, in the first years of the New Partners for Smart Growth conferences back in the early 2000s, we had tracks on this issue. It somehow dropped off the agenda for a few years after that. Although we are trying to bring it back in more recent years. And then in 2004, we prepared this fact sheet presentation that you see here on the right for Fannie Mae specifically on strategies to reduce crime around multifamily housing. And then most recently, as Karen mentioned, we've been working on this guidebook with support from the California Endowment and Department of Public Health. The guidebook's goals really are very simple. They're to try to integrate these principles of crime prevention, more significantly into land use planning and development practice. These ideas about crime prevention through community design have been around for 30, 35 years now, but we still see a lot of planning departments and planning agencies and development agencies that don't really take them into account. So we'd really like to emphasize their importance and get them really at the forefront of the approaches that these agencies use. We also wanted to identify strategies that we thought would work throughout California and beyond, really. I think they're applicable in any part of this country and probably in other countries as well, that can be pursued to reduce crime and violence and increase community safety. Before I get started, I think it is important to recognize that this issue of crime prevention is a very complex one, and we're really only touching on one aspect of it, and that is how the built environment impacts that. And there are many other strategies out there. Obviously, there are a lot of socioeconomic and psychological issues you can get to when talking about crime prevention. But when we're looking at it from the built environment side, we often use this crime triangle. And it really helps us to sort of think about the fact that in order for crime to occur, you need the offender, you need the victim, but then you also need the opportunity. And with these strategies of crime prevention through community design, what we're trying to do is reduce those opportunities. Offenders often ask themselves, for example, how easy is an area to enter to commit a crime? How visible or attractive or vulnerable will the targets be? What are the chances of being seen or being caught? If somebody sees me doing something illegal or victimizing somebody, will anyone do anything about it? And is there a quick way to get out? So these are issues that often arise that can be addressed through community design approaches. So the whole approach of CEPTED, or community crime prevention through environmental design, which emerged back about 35 years ago, really looked at a multidisciplinary approach to deterring criminal behavior and focused specifically on influencing the offender decisions that precede criminal acts. And what they looked at, what they've been approached, the approach they've taken is to look at natural surveillance. That is, are there eyes on the street? Are there eyes on public spaces? Are places being looked over by the rest of the community? Is there natural access control? Are we guiding people to proper entrances? Are we decreasing opportunities for crime by making sure that people don't get sort of hung up in an area where there isn't that natural surveillance and a sense of safety? There's also the issue of territorial reinforcement, of creating a sense of ownership over spaces. For example, distinguishing a private space, maybe a private front yard or a semi-private space from a more public or semi-public area. And finally, the issue of maintenance. We know that disorder leads to further disorder and can cause fear and lead to decay. So one of the documents that we've often looked to for ideas on this is a book that was published some years ago. I think it's been over 12 years now, by Al Zelinka and Dean Brennan. Al is a planner by background. Both of them are planners. Al, in particular, now works in planning in Riverside, the city of Riverside, and I believe he's now the assistant city manager there. And what they've done very effectively in this book is identify those aspects of crime prevention that the planning profession, that the development profession can look to. So I'm going to talk about these very quickly, the 4 human factors that really need to be considered, that people need to feel safe, and then some of the implementation approaches. The first human factor is simply one on information orientation. To feel safe and enhance our safety, we need to know sort of where we are, where we're going, and what the rules are. And that can be done as simply by putting up kiosks, by having gateways, by letting people know when they've entered a neighborhood or a type of community or even a city. There's also the issue of interaction and socialization. We know that we want to create the opportunity for people to interact comfortably and build community. That can be done through parks, as we see in these images here, a small park in the top image, or a large park in the lower image in New York City. It can also happen through farmers markets or simply places where people can gather, where it's comfortable to gather, where there's that sense of safety and security, where there's good natural surveillance. The other principle that we need to consider is that of ownership and stewardship. I talked earlier about the importance of distinguishing between private property and public space. And we know that by having, in this case, for example, that small fence there, it doesn't block people's visibility. You can still see in and out of that home and see people who are out on that balcony. But it does define where the public space ends and the private or semi-private space ends. And it also allows us to maintain those places, for people to have ownership over those places and spaces and maintain them well and create that, again, that sense of community that's so important. And that can also, we see that exemplified here, just in the way these buildings have been designed and built. where it's clear which part of the building, which part of the property is accessible, that there's a lot of visibility there, but notice that some parts are more accessible than others, and clearly to come past that fence in the lower image, you need to be invited in by the people who live there. Then there's this issue of seeing and being seen, of eyes on the street. We need to know that others are aware of our presence, and we can accomplish that, again, through construction, through the design of buildings, by having, by having porches, by having balconies that look out on these public spaces. In the evening, lighting becomes very important, and we hear a lot of concerns in communities about whether there's sufficient lighting for people to be out and about in the early mornings or in the evenings. And even in commercial establishments, like in the coffee shop in the lower image, being able to see out and be able to see in, again, help create that sense of safety and security. These images just illustrate the difference in how that comes across, you might say, in how a house is designed. In this case, we see a lot of eyes on the street. If you actually identify those, you've got that front porch area, you've got windows facing out onto the street. Here's a newer example of that from a new development in Chico, again, with a lot of spaces and places where people are surveilling the public space beyond the home. But we do also see a lot of examples where we've forgotten to do that, where we have blank walls or garage spaces that just dominate the front of homes and really don't provide those eyes on the street that are so important. This is another example of how we can transform that type of development. Here we have buildings that turn their back on the street, that really diminish the security on the street. And through, in this case, Photoshop, we can just alter that building and orient it back to the street, and then really make it, add the amenities that make it feel like a much nicer place and a more comfortable place where one can spend time. Finally, on the implementation side, and this will be particularly important, I think, for planners out there, we really want to think about how do we combine uses through land use and design that, again, help to provide that surveillance, that sense of territoriality that create a safer place. Here again, we see examples of mixed-use development. In this case, vertical mixed use with retail on the ground floor, housing above in both these cases. In the upper image here on the Safeway that you see in the upper right image, it's actually more of a horizontal mixed use where you have a shopping center with housing on the left side of that image. Those are apartments that you see in the distance. And then there's the issue of activity and programming. Particularly with public spaces, it's important to figure out how to activate those spaces so that people are using them, so that they feel that people have ownership over those spaces. In these two cases, we see either a fair, an event taking place in a public park, or a farmer's market on the fringes of a park. All of that helps to really make sure that people know there's activity around us and that activity is taking place in an orderly fashion. And that can also happen in other settings. In the lower image, we have in the city of Denver, for example, they have these chess tables that are just arranged on the transit and pedestrian mall where people gather, and there's that orderly activity taking place. And then on management and maintenance, we want to make sure that spaces are managed and maintained, again, for their intended purpose, that people know that people that there's ownership and pride in these places, and that people will care if somebody does something to vandalize or diminish those spaces. So I want to end with another reference. I think I've talked quite a bit about the book that Alison Linka and Dean Brennan wrote, Safescape. There's a newer book out, just I think about a year or two old, Crime and Planning, where Derek Paulson, the Commissioner of Planning in Lexington, Kentucky, talks about the importance of considering this issue of crime prevention in everything we do in planning, and particularly incorporating it into smart growth and sustainable development. We talk a lot about sustainable development, but often we don't think about this issue of crime prevention. And in order for a community to be sustainable, we know that it has to be a safe place for all residents that live and work there. So I'll end there, and I guess we'll pass it on to the next speaker. Thank you.
Thanks, Paul. This is Karen again. Just a reminder for folks, we are going to answer questions at the end, but if you have questions now, you can send them along now, and we'll get to them. We'll get to them at the end. So I'm now going to turn things over to Maureen Silva from Prevention Institute.
Thanks, Karen. I'm just going to go ahead and wait another minute for the presentation, and then I can start. Okay, great. So I'm just going to build off a little bit more of the principles around SEPTED that Paul has introduced and talk a little bit more about the Collaboration Multiplier, which is a tool that we have been using at Prevention Institute for a number of years to help communities in multiple sectors really think about those joint strategies and shared solutions that they can accomplish together. The Collaboration Multiplier will also be a part of the SEPTED guidebook, and that aligns well with many of the SEPTED strategies outlined. Go ahead and to the next slide, please. Just as a little bit of background, Prevention Institute is a national nonprofit. We're based out of Oakland, California, with offices in Los Angeles, Sacramento, Houston, in addition to Wisconsin and DC. We work on a number of community prevention-based initiatives with health departments, community-based organizations, city officials, and local government to really develop cross-cutting strategies that reduce chronic disease and promote a comprehensive approach to increasing health and equity in communities. Next slide. Even though you all are on a webinar, we did want to make this somewhat interactive. So we'll be doing a brief activity called What's Collaboration Got to Do with It? Go ahead and utilize the text box where you can input a lot of your answers. I'm going to be showing you a few different images. And what I'd like you to really think about is in these images, they'll be conveying an issue around health and safety in a particular community. So I'd like you to, in the text box, indicate what partners you feel like would need to be involved to better address community health and safety. So we'll go to this first slide. What's collaboration got to do with this image? Who should be involved? What sectors should be involved to adequately address this issue? And we'll be going through this section fairly quickly, so if you can, as quickly as you can, type in the box, and then we'll move on to the next image. But you'd want to think about what partners need to be involved to adequately address the issue around no sidewalks. There's obviously a lack of physical activity happening. There's some environmental concerns as well. So what partners need to be involved to adequately address this issue? I'll give just another couple seconds.
And actually, if everyone could put their thoughts into the chat box, and that way everyone can see it. And then if you have any questions for the speakers, if you can put that into the question box, that will be what we'll answer towards the end of the webinar.
Okay, so we're going to move on to the next image here. What's collaboration got to do with this image? Go ahead and type in your answers as to what partners you think need to be involved to adequately address what's happening in this image. So oftentimes I think we think of public health, but who else needs to be involved to really adequately address this? So schools is one. Who else needs to be involved? Code enforcement is another one. So as you can see, there's more and more partners that are needed to really address what's happening here. We have tobacco advertising, there's loitering happening, it doesn't look like the safest community, and there are a number of ways that we can really adequately address that. We'll move on to the last image. So what's collaboration got to do with this image? Here we have some children that are playing in a dumpster. There's a mattress, and this has everything to do with the fact that in this particular community, which was taken by Latino Health Access, there was not safe places to play for these kids. And because, as we know, kids are creative, they will find many other places to play if needed. So what's collaboration got to do with this issue, and what partners are needed to kind of really address some of the health and safety implications? I'll give you another few seconds to type in any other answers, and we can move on.
This is Karen. I think that people could maybe only answer into the questions, but we've got lots of answers for parks, schools, property owners, parks and rec, planning, parks, schools. So
great, wonderful.
Playground needed in all caps.
That is helpful. I think I'm having trouble seeing that on my end, so that's helpful to have that reiterated. So we'll go to the next slide, and I think really what you all have seen and probably have witnessed in your own communities is that these images really demonstrate that when we think about community design and its impact on health and safety, we know that there isn't just one sector that can adequately address this issue alone. And we can go to the next slide, please. We've seen a number of police officers and law enforcement really kind of say over and over again that we cannot just be arresting our way out of this problem, and that it takes multiple sectors to really address community safety in a meaningful way that goes beyond just the scope of law enforcement. And the same is true when we're talking about a number of different issues that are related to community design, like making parks more accessible and increasing healthy food options, and even decreasing community violence. We need intersectoral collaboration to address multiple factors that come up, and joint solutions are one way to really impact the community health and safety. So these are some common questions that come up when we talk about intersectoral collaboration. Oftentimes we hear things like, how does collaboration impact community health and safety? Who should be included at the table? And how can organizations leverage each other's expertise and resources? How do we ensure that collaborative partnerships are sustainable over time? We've seen through a number of different efforts that designing healthier communities isn't something that happens overnight, and oftentimes this takes a lot of time, and we need additional support from multiple organizations and community stakeholders. And then lastly, what do you do when partners have different goals? And I think one way that we'll start to answer some of these questions is through the Collaboration Multiplier framework. Next slide. The Collaboration Multiplier tool is one framework that we developed by Prevention Institute to help answer many of these questions. It's a tool designed to achieve effective multi-field collaboration by really helping a number of different groups from different disciplines understand the contributions of their partners and better align and strengthen many of these collective efforts. So we'll walk through the Collaboration Multiplier very briefly today. Also, just keep in mind that oftentimes when we have done a Collaboration Multiplier training, this can last anywhere from 4 hours to 2 days, and we're covering it today in about 20 minutes. So I'm assuming there'll be a number of different questions on how to use the tool, and I'll be sure to provide some additional resources to help with that. So we'll go to the next slide, please. The Collaboration Multiplier really helps multidisciplinary groups with a number of different objectives, and one of them is identifying common and divergent approaches. The first phase of the Collaboration Multiplier, which is the information gathering process, really helps to identify what some of the direct comparisons are of approaches across sectors and to understand where some of the sectors have commonalities and also where there are some differences. It also helps take stock of individual and collective resources. We know that collective resources can be leveraged to advance specific goals and mandates of the participating sectors as well as the whole collaborative. It also helps us identify who or what is missing and tailor a pitch to engage a more diverse set of partners. The Collaboration Multiplier offers what we call a structured process for identifying where there are gaps, and it suggests how to fill them by clarifying who else is needed at the table. It also helps us forge comprehensive approaches and joint solutions. This results in a set of shared outcomes and strategies that we'll talk a little bit more about that spans the entire partnership or can be accomplished by a specific subset of partners. And lastly, it clarifies how people from each discipline view and approach an issue differently. And we do this by mapping out specific strategies using the Collaboration Multiplier tool that are appropriate for each partner involved. And it also holds each sector accountable for their contributions and credits accomplishments where necessary. So we'll move into the information gathering process in a second here. And on the next slide, you'll notice that we've mapped out phase 1 and phase 2 of the Collaboration Multiplier process. Next slide. The steps in this process are grouped into 2 phases. As I mentioned, first we have information gathering and the analysis. And we'll walk through both of these phases by plugging in a community example from the City Heights Educational Collaborative. The City Heights Educational Collaborative will be featured in the SEPTED guidebook, highlighting this approach to addressing not only academic performance, but also how they were able to impact the health through a community-based approach and really kind of thinking through how they can create a community hub in a lot of these schools that were having some issues in terms of low test scores and educational attainment. So let's move to the next slide on information gathering. Information gathering is what we kind of consider to be the getting to know you phase of phase 1 of the Collaboration Multiplier tool. This is really a structured discussion that we have formalized as a process to ensure that we're all starting out with good information. The types of information that groups need to really be thinking about with their partners are about establishing collective goals and bringing other partners to the table. Oftentimes this is one piece when we're kind of trying to move into action and coming up with joint strategies. This phase gets overlooked. A lot of partners don't really kind of think about what information they need from partners to be able to address community safety. So we'll go over each of these bullets, and again, this isn't a comprehensive list, but this is a starting point of some of the major pieces of information excuse me, that we need from partners, but you're also welcome to add to this list if there are specific pieces that are most relevant to your issue. So the first piece is thinking about what is the importance of this issue? Why is this specific issue important to the partners involved? And how can we really be making the case for it? What is the sector's mandate? What are each of the organizational goals? And how can these goals really align with what we are collectively looking to accomplish? What are the expertise, assets, and strengths? And what unique expertise does each sector add to the collective process? And this is really thinking about some of those resources, including skills, staff, even funding, and relationships that each partner can bring to the table from other sectors. What are the strategies and activities from each sector that relate to impacting health through the way that the community is designed? Who are the audience and partners? This is really thinking about the primary audience that this organization or sector serves. What relevant data can this partner access and how can it be collected and utilized? And then lastly, what are some of the desired outcomes? Just thinking about the specific results each sector would like to see can really make the collaborative worthwhile for them. It's really kind of thinking about what success looks like for this partner and how does the collaborative meet them with some of these successes. We'll go to the next slide. So we've mapped out with these puzzle pieces how the City Heights Educational Collaborative was able to engage in this process. The City Heights Educational Collaborative set out to build a collaborative multi-sector partnership with 3 schools in the San Diego area with the support from San Diego State University, the San Diego Education Association, and Price Charities. And again, this was really to help better understand how they could achieve educational excellence and also really understand how they could start to boost some of the test scores that were low in these City Heights schools. They also knew that they needed to go beyond just the educational sector alone. There were a number of community affiliates that helped to inform the decisions of the collaborative and think through how students can be better prepared academically and just really kind of increasing a lot of the support that was happening around social services to students and to their families in the community. So a number of organizations that represented the collaborative were community health organizations, Head Start programs, Parks and Rec, neighborhood agencies, housing associations, and community leaders. And as you can see here, we've grouped them into these buckets, which the puzzle pieces indicate: education, law enforcement, health services, and parent groups. We'll go to the next slide, please. And this really is how a grid should look and how it should be designed as it's completed. In thinking through many of the elements that we laid out in the information gathering phase, the sectors as part of the City Heights Educational Collaborative were able to agree on a common goal. And that goal was to improve the school environment through health services and educational opportunities to better support students and their families through this more holistic approach. Next slide, please. The activities in phase 1, the information gathering phase, really set the stage for the analysis activities that we see in phase 2. The phase 2 analysis brings together partners to discuss the information they collected in phase 1, to move them into action and align many of these resources for the greatest impact. And to do this, they need to identify what the shared outcomes are. In this process, partners map out what they can achieve together and really think through what some immediate next steps are needed to accomplish this. Then they look at and determine collective strengths and assets. And this is really kind of posing the question, what are the partners' strengths that this group can utilize? And then lastly, they come up with joint strategies. And this is really about what are some strategies that 2 or more partners can work together on to be most effective in this process. And in this next slide, you'll see a completed collaboration multiplier that we filled out for the City Heights Educational Collaborative. And the groups that represented the City Heights Educational Collaborative were able to identify shared outcomes that they could accomplish together by combining their respective strengths, as well as these joint strategies to pursue together that we've talked about. And so the outcome was that these public schools in San Diego through the City Heights Educational Collaborative now operate as what's called community schools. So they provide health and social services to students and their families, and that means that in addition to a lot of the academic instruction, the schools in the City Heights neighborhood provide a more comprehensive health and social services support to students and their families. So each of these campuses support a health center. They have a well-trained staff that provides individual tutoring. There's a number of different workshops provided for parents, and they also have social services, case management, and counseling on site. So this unique partnership has been a really effective way to invite community members into a shared leadership position and also to lend their expertise. So they're playing a pretty major role in the ongoing decision-making process and support changes that are happening in each of these schools. There's also parent groups that convene on a regular basis with law enforcement, school administration, and they come together to address barriers and come up with solutions in students' ability to walk to school safely. So there's a number of other programs that have now been implemented as part of the collaborative and with the help of community input. And this has included parent centers. There's a number of groups of volunteers that come together to provide student and teacher support. They also have dental screening programs and immigration services as well. So all of these pieces that make up this collaborative would not have been able to happen without this community partnership. And it's allowed many of the residents to use the schools as the centers for mobilization and just to leverage a lot of these community resources more effectively to promote positive health and safety outcomes. So we'll move to the next slide to talk a little bit more about some of the next steps after the collaboration multiplier process. Once you've had a chance to complete the collaboration multiplier matrix, these are some potential next steps that you may want to take. Tailoring your messages to engage different fields in achieving your goals is really effective. Also, identifying additional partners, conducting outreach to them, and learning how they fit into the matrix is also crucial. Oftentimes, when we start on a collaborative process, we can have a set of partners using the collaboration multiplier tool, but there's always ways to kind of build in more partners to help streamline and build momentum for other efforts. You can also build and strengthen the coalition, and this helps to develop a comprehensive strategic approach as well. We'll go to the next slide. And lastly, we just wanted to provide a few resources from Prevention Institute that would be helpful in learning a little bit more about the collaboration multiplier process. There's a publication that we have come out with recently, a multi-sector approach to preventing violence, with funding from the Kresge Foundation that really reflects a lot of the best thinking around multi-sector collaboration in about, I think it's 14 of US cities and counties, and it goes into deeper detail on how to use the collaboration multiplier. Full disclosure, it's about 300 pages, but if you're interested in kind of a shorter, more condensed version, we also offer a companion document that outlines the benefits and challenges of multi-sector collaboration and provides a little bit more of a brief overview of the collaboration multiplier process. The longer guide has more activities and worksheets that you can work on with partners. And then the second resource that we've provided is our paper that we will be publishing on community safety by design. It'll be coming out within the next month or so, and this is really a review of the literature with over 24 folks from public health, planning, and justice sectors that reflect on opportunities to promote community safety, prevent violence, specifically through land use strategies. And there are specific strategies outlined for each sector. So again, if you're interested in learning a little bit more about when this paper is released, I encourage you to sign up for our e-alerts on our website, and you can learn a little bit more about some of our resources that way. Next slide. So again, just wanted to thank you for allowing me to talk a little bit about the collaboration multiplier tool, and hope that this was helpful and that you are able to use it in your own communities.
Thanks so much, Maureen. So now that we've heard a little bit about kind of the theory and the collaboration, I'm really excited to have a local example for you all to learn more about. Thanks so much.
All right. Hi, everyone. Again, my name is Shaunda Johnson. I'm a program administrator with Health Education Council. We are a nonprofit based in West Sacramento and have the goal of being dedicated to providing access, education, advocacy, and training to empower individuals towards a healthy life. We are focused primarily on eliminating preventable causes of death that result from the use of tobacco, poor nutrition, and lack of physical activity. We operate more than 25 public health programs nationwide to meet the needs of diverse communities by increasing access to health-related knowledge and information. And I'll be sharing today on how our agency has been working to accomplish this mission through our Kaiser-funded HEAL initiative. But first, let me give you some background information about this health model. So Kaiser Permanente's healthy eating, active living approach has been evolving since its inception in 2005. The original Kaiser place-based investments called HEAL CHI were focused primarily on policy, systems, and environmental changes, better known as PSE, as the most effective and sustainable ways to improve HEAL long-term. But the second phase, called HEAL Zones, in addition to PSE strategies, grantees were asked to narrow their zone geography and pursue strategies that increase both individual and family awareness, knowledge, and skills to make healthy choices and ultimately behavior changes. These smaller zones with strategies of engagement at multiple levels, individual to policy, have demonstrated strong progress toward community transformation and resident engagement. So while every zone has some unique characteristics, there are 5 key components to the model of the HEAL zone. One, it's a small, clearly defined community of 10 to 20,000 residents where existing community assets can be targeted to accomplish healthy eating, active living goals. Second, HEAL zones were asked to create evidence-based and sustainable strategies, including at least one community infrastructure and one education strategy for each of the HEAL goals. Community infrastructure strategies create an environment that supports or encourages healthy eating and active living, includes policies, organizational practices, systems change, and built environment changes. Third, it requires an involvement from a multi-sector network of local groups such as residents, schools, and businesses. The collaborative contributes and leads the strategy development and are the key implementers of the work. Fourth, there's a high emphasis on high-dose strategies, meaning that the strategies reach the most amount of people with the strongest intervention so that we yield the biggest impact or improvement. And an example of that would be moving from a practice to an actual policy that affects a broader number of people. And out of their learnings from previous years of work, Kaiser learned more about community conditions that enhance or create barriers to achieve HEAL goals like violence and social support. These factors were put into 4 categories and are being called facilitators, given that when in place or improved, they can have a profound positive impact on an individual's or a family's ability to adopt healthy behaviors. Next slide. So the facilitators are there at the bottom of the screen: community safety, neighborhood cohesion, social and emotional health, and family resiliency. And the blue box contains the objectives to which each of the grantees were asked to develop strategies around. Next slide. So now taking a look at Valley High's specific HEAL zone area, this is to show you again how concentrated an effort this is. It's a very small geographic area. It's only part of one zip code, and listed on the left are some of the existing resources or assets that we sought to target for change. Next slide. So some characteristics of the Valley High community. From 2008 to 2010, Sacramento was identified as having the 2nd highest violent crime rate per capita, and it was largely due to the violence that was happening in this particular community, specifically on its main corridor called Mack Road. It was second only to Oakland, and we still rival 2nd in the city for the highest amount of violence and crime today. There's lots of low-income renters moving in and out of the apartments, as well as really high managerial turnover. And this means that, you know, the residents don't have a chance to really create any trusting relationships with those who are kind of in positions of authority with them. The houses are surrounded by long-term homeowners that actually make an average median income. So you have this kind of this dichotomy in this community of really vested residents and then those who are just coming in and coming out, which creates, you know, quite a bit of tension. Sacramento is one of the most diverse cities in California, and South Sacramento is home to the widest range of ethnic populations. This plays a significant role in developing culturally competent strategies or intervention that reach HEAL goals. And then Mac Road is the Las Vegas strip of fast food. So there are two McDonald's within a quarter mile of each other. And any of you who have ever been in or have done any work in low-income communities know what other types of small businesses are present: liquor stores, chicken shacks, laundromats, you name it. So not a whole lot of businesses that support healthy eating, active living. And then lastly, every community needs a location that serves as a hub for bringing residents together. Valley High lacks that resource, and it has created silos amongst various ethnic populations who are forced to gather at places of worship, which we all know are very segregated. Next slide. So for our collaborative approach, we know that where people play, pray, work, shop, and live have to be targeted to impact behavior changes. So many of the organizations, there were many organizations serving the Valley High community in different capacities, and some had established partnerships for specific events or activities, but most of the work was happening in silos. So the Heal Zone Collaborative brought together a web of partners using a layered approach so that we could reach different layers of the community, so that each resident was exposed to multiple opportunities and messages that support HEAL on a daily basis, in a way following the social ecological model of individual, neighborhood, community, and broader areas outside of that. Working in the collaborative are representatives from each of these sectors. So at each of our monthly meetings, there is a representative from each of the groups that you see listed in this web. And then Health Education Council served as the backbone community-based organization and the fiscal sponsor of this initiative. Next slide. So our initial steps involved engaging our community based organization partners to guide residents through a number of neighborhood assessments to identify and prioritize efforts. This information gathered was used to create a community action plan that served as a living and guiding document for strategic planning, and it continues to be updated as we go. So some of those assessment activities were focus groups where we met with residents, asking them a series of questions to get their feedback about the priorities in the community. We did surveys that went out to households that gathered information as well. We did some organization interviewing where we talked to organizations who had been doing work in the community to gather their perspective on the issues. And then we actually attended a national charrette that we participated in with the local Building Healthy Communities group in Sacramento. And that is a community planning model that engages all stakeholders to create and support a feasible solution that leads to transformative community change, predominantly used for physical planning, but can also be used for public policy development as well. We also did photo voice projects, and this is just a way of capturing resident perspectives using photos with captions that describe their feelings or vision for the image. And then lastly, we used walk audits, which involved walking particular routes or areas to assess needs, challenges, etc. And on one of the initial walk audits that took place in one of the major parks, Valley High Park in the area, a very underused resource with rundown recreation equipment, had a history of gang violence activity and nearby traffic safety concerns. A group was conducting a walk audit and gunshots were actually fired at that time. So the work was halted Fortunately, no one was injured, but it definitely caused us to have to reevaluate the priorities of this initiative. My personal feelings were that residents had really forgotten about the park and that it was sort of a space for them to engage in hill activities. And so those who, really were displaced took advantage of that opportunity and kind of created that space as their own playground. Sorry, next slide. Instead of deterring progress, this event actually served as a catalyst for non-traditional partners in an array of fields such as violence prevention, law enforcement, business, youth development, redevelopment, and others to rally residents together to improve conditions. A committee made up of these partners called Live Well Valley High began meeting monthly to reclaim the park, and the first line of business was engaging the very young people that had sparked the effort through a summer basketball league. So in summer of 2012, we launched a 9-week basketball league for 80 youth aged 14 to 17. Local churches provided volunteers as coaches and security. We integrated healthy eating, active living work by training all coaches in Rethink Your Drink and establishing a water-only policy for players. We also hosted spa water tables for spectators. And while the registration fee was only between $0 and $10 based on income, for those families that couldn't afford it, they were allowed to walk off, I say that in quotation marks, their fees by doing a number of laps around the park to equal the actual cost. We ended up with over 300 spectators coming to watch weekly, and everyone at the basketball games were exposed to healthy eating, active living work. These efforts were leveraged to get the city to make some minor improvements to the basketball courts and park landscaping. Of course, you want to know, were there any naysayers who said it couldn't be done? And yes, there were. And as a matter of fact, one of them was the police captain for the South Sacramento area. And I like to use his quote that was put in our local paper, where he states that initially he planned to have 2 officers patrol the park during the games, but he said now it's not needed. It's not just players who are getting exercise during the games, which have changed the whole atmosphere of the park. On one Thursday, there were children on the playground, moms pushing strollers, people walking, a soccer game, and a volleyball game. The park is infused with so much great activity. I now go weekly as a fan. Next slide. And so this basketball league really put a spotlight on the activity that was happening around the park. So in the bottom left picture is a crosswalk leading to the park where residents use Photo Voice, use the Photo Voice project to lift up concerns over pedestrian safety accessing the park. This road has a very busy and high miles per hour limit, and the crosswalk design prevents cars from seeing pedestrians who want to cross. When taking this photo, the person who took the photo said that they had to cross the street and got to experience the dangers of the crosswalk. Cars don't see pedestrians due to blind spots. To fix this issue, the Photo Voice project participant suggests that a crosswalk should be put in to ensure pedestrian safety or at a stop sign. We learned during the basketball league of an apartment manager named James Shabazz, who had actually been engaged in advocacy efforts around getting a traffic signal installed there at that corner. He, being a longtime manager, has seen multiple people be hit, or kids have to, duck and dodge in order to get across the street. So Hillzone got involved, and by supporting his advocacy efforts, was able to make streetscape changes and park improvements by partnering with the city, and this ultimately led to an installation of a hawk signal, a high intensity activated crosswalk that pedestrians can actually push a button and it flashes a beacon so that they can cross the street safely. And unfortunately, a week before the hawk light was unveiled, James Shabazz, the apartment manager, passed away, but I was able to get word to him prior to that his efforts were not in vain. Next slide. So after immediate safety issues were secured, new programming was steadily added to the park to draw residents to the new facilities, which included sports leagues, exercise classes, and a weekly walking group. Local churches actually relocated their community outreach events to the park. So we had a number of neighboring churches who actually started having their Sunday worship in the park once a month. In spring 2014, the reclamation of the park got a boost from Reimagine Mac Road, which was a volunteer-driven one-day event to transform the Mac Road corridor area with landscaping, painting, lighting, home renovations, and a new community center. Over 1,000 volunteers made more than 30 improvements, and all of these happened in the Hill Zone geographic area. Next slide. So the outcomes of all of these activities were, one, infrastructure improvements that really supported active living. By engaging residents and youth, we were able to establish a core group of residents that bought into the mission and were able to promote and advocate for continued healthy eating, active living zone goals. Where before the work was being done individually, most of the work is now being done collaboratively. And that synergy has really led to an increase in morale in the community and a coordination of efforts. These outcomes proved to be the readiness factors for piloting an innovative program in the Valley High community called Summer Night Lights. So this Summer Night Lights is modeled after the very successful LA program. It's a violence prevention program that engages the whole community, including the perpetrators of violence and those that may be potential victims. It ran for 14 weeks during the 2014 summer, which are the highest crime months, and we housed it right on Mac Road, where the highest crime was taking place. It included 3-day-a-week programming from 7 p.m. all the way till midnight, and provided food, fun, fellowship, and fitness via basketball, soccer, salsa dancing, line dancing, etc. And this program really fostered community growth and trust, not only between neighbors, but also between the community and law enforcement, which we all know right now is kind of at its highest tension peak. And all of this resulted in a drastic reduction in every level of violence in the community. Next slide. So just first year stats from the Summer Night Lights program. Robberies were down 50%, simple assaults were down 100%, and for the first time in more than 30 years, there were 0 homicides in the Valley High, on Mac Road corridor. And so we ended up with over 10,000 participants during that summer, and this program was again promoted this 2015 summer and had even more astounding results than the year before. And so I look forward to any questions that you might have about this initiative, and thank you again for allowing me to share on our efforts.
Thanks so much. So just a reminder, please send any questions along that you have. I want to start with a quick one for you, Shaunda, which is lots of places won't be lucky enough to have funding from Kaiser, and I'm wondering if you have thoughts about pieces of your work that were low cost and that communities could implement even without kind of a big infusion of outside funding, because obviously having staff and resources is useful, but presumably some of the work was lower cost. So if you could talk about that maybe.
Right, and I think for the most part, a lot of our resident engagement work was little to no cost. A lot of the programming that took place at the parks, as I mentioned, the local churches really played a key role. They have their own budget that allowed them to move their resources to the park. We actually have a walking club that takes place every Saturday morning at the parks. Very little to no cost. You just need people to come out and walk. And we actually partnered with the Sacramento Food Bank, who provides the free produce for that walking club and those participants. So for the most part, I mean, really, if you have engaged residents and perhaps even resident champions, as we do, you can get a lot of the community engagement work done with little to no cost. It's kind of that back end work that you really need the staffing support for. But you can easily get started with community engagement with little to no funds.
Great, thanks. One other question that came in related to the Summer Night Lights was whether it included a gang prevention model and specifically interveners like the LA model has.
Yes, so we did have intervention workers who did a lot of the pre-work and going around and talking with known gang members, letting them know the program was coming, not necessarily getting their okay or buy-in or permission, I should say, but kind of letting them know that this is going to be a positive activity, that we didn't want any of the violence to really affect this program, that their families were welcome, and they also served every night kind of as, I'll say, security, really just being a lookout and helping form those relationships with law enforcement and creating a safe place for everyone who participated.
Great, thank you. Another question came in is, do you have suggestions on how a community might approach an existing park which has had a decline of neighborhood use and become a hangout for transient population? So I think you've spoken a little bit about that, but I also want to turn it over to Paul to answer that a little bit.
Yeah, definitely. I think we've actually had some experience with support from the California Endowment in looking at some existing parks and communities, and particularly in Kern County, that really were not being claimed by the community. So they were basically taken over by some of the negative elements in the neighborhood. And part of the problem is that some of these parks were built 30, 40, 50 years ago. Some of them haven't been maintained that well, and some of them have things in them that the residents, the neighbors that live nearby don't really enjoy using anymore. So what we were able to do with this California Endowment grant was to do a small community engagement process. We did sort of a mini charrette, spent a day or half a day at the park, walked the park with the neighbors. We had great support from community-based organizations there. We brought in a landscape architect who could provide some ideas for changes to the park. And through this very simple process, we ended up with a new plan for revitalizing the park. And fortunately, in that case, the county supervisor was able to get some funding in the next 6 months to start some of the changes. Of course, that is where the biggest challenge occurs, is that once it gets to building something, then the costs do go up. We're actually going to be doing 2 more of these in the next few months in Merced County, in the town of Winton, and then also in the city of Salinas. So we're hoping that we get more experience with that. But I think that definitely communities need to go back and look at existing parks, see what changes need to be made, talk to community members, find out what would get them to take greater ownership over those parks and therefore make it a safer place.
And Maureen, I want to tag on to that question, and I think you might have some thoughts about from a health equity perspective, thinking about parks where there's potentially a transient population and how to make sure that folks who are homeless or who need other kinds of supported are not just kind of kicked out of parks with nowhere to go, and whether you have thoughts kind of from a health equity perspective or from a collaborative perspective, who you might specifically want to bring in to address that.
Yeah, that's a really interesting question, and I feel like that can be addressed in a lot of different ways. I think oftentimes when we think about parks and transient populations, there's a lot of really different viewpoints, and to be honest, there's a lot of opponents that have kind of not always a shared vision on how to address that. And I think oftentimes what really needs to be happening is shifting a focus and really forging a shared vision across sectors to communicate a little bit better with each other, kind of really understanding, how to address the issue in the most meaningful way to bridge a lot of these connections and, kind of think through what some of those joint solutions can be. And also another piece that I think oftentimes really gets overlooked in creating strategies and policies to increase health and safety in communities is really being able to build trust and overcome a lot of the preconceived notions that are occurring among organizations and among individuals in the community, and then finding a common agenda to advance a lot of these goals collectively to really kind of achieve a lot of that.
Great, thanks. So one other question for potentially any of you, but can you talk about any other communities that you've seen that have incorporated some of either crime prevention through environmental design or other kind of related approaches into their work?
Well, I know that there are cities in California, Oakland comes to mind, for example, that have developed checklists, for example, for developers coming in, with a project that sort of reminds them to think about these issues. And I think, there are, and I think the guidebook is going to include some good information on those types of approaches. I think, as I mentioned in my presentation, I think these concepts and ideas have been around for a long time, but we still find that a lot of communities, a lot of planning departments, either for lack of understanding of these approaches or just lack of capacity, have not been addressing them. So developing simple checklists, I think that you can provide a new developer, especially somebody building housing or a commercial project, that gets them to think about this, and then also working with across different departments. We're now seeing police departments, law enforcement, working alongside code enforcement, planning, parks departments to really share ideas and solutions. I think all of those are really good, and they're also strategies that don't cost a lot of money. They can be implemented fairly easily.
Great.
Yeah. And,
go for it, Maureen.
I just wanted to piggyback off of Paul's comment. There, I think, are a lot of communities now that are starting to think a little bit more about some of the community-based participatory research that can help to inform what some of the issues are in the communities, and also can point to some of the assets and solutions. One way that we've seen that happen is actually through a community in Houston, where there was a youth serving organization that did an assessment and found that young people didn't feel safe in their community. And actually, through this assessment and through kind of some of the focus groups that happened, they found that these young people were having to go through this vacant land where there was a lot of illegal dumping happening. There was some drug activity. It wasn't safe, or it wasn't perceived as safe. And so I feel like more and more we're seeing these communities that are engaging youth as part of the process and not just part of the outreach, which is making a huge impact in the engagement among the community, but also kind of as key partners in being able to develop a lot of those solutions. And so with this example in Houston, community was engaged, public works, public health, and a number of other organizations to really develop a process to clean up this vacant lot and make it a place for people to be able to not just walk safely through, but a place for people to convene and go in the community.
Great, thanks, Maureen. So that is all the questions that have come in. So I think we're going to end a little bit early. I'm sure all of you have other work that you're happy to go do. I want to really thank Paul, Shaunda, and Maureen. This has been really wonderful, and thank you to the Local Government Commission for organizing this. As a reminder, all of the PowerPoints will be posted online. The materials that Paul and Maureen talked about are also available online, and I think that in all of our slides we have our email addresses, and I suspect that we're all happy and willing to talk if people have additional questions, want additional resources, or just talk about all of these issues. So thank you very much and have a great afternoon.